Today we will continue to learn the 8 principal syndromes. My name is Hu Ying. I'm with the TCM department of Xinjiang Hospital. Cold versus heat. Syndrome cold or heat in nature reflect the deficiency or excess of yin or yang as stage in the canon of medicine. Predominance of yang gives rise to heat, and predominance of yin gives rise to cold. In addition, as the rules of treatment, cold syndrome should be treated with hot propertied drugs. Heat syndromes should be treated with cold propertied drugs. Therefore, the differentiation between the cold or heat nature of a syndrome is of great clinical importance. Differentiation between cold and heat in exterior syndromes has been discussed in the previous section. Cold and heat syndromes of the interior are much more complicated, for different causes and different internal organs give rise to diversified manifestations. Generally speaking, the cold syndrome of an internal organ refers to the hyperfunction of that organ, and the heat syndrome to hyperfunction. The common features of interior cold syndromes and those of interior heat syndromes can be described as follows. Interior cold syndromes: pallor, intolerance of cold, absence of thirst, loose stools, clear profuse urine, pale tongue with a white coating, and slow or tense pulse. If there is a pain, it is aggravated by cold and alleviated by warmth. If there is expectoration, the sputum is thin, frothy, and whitish. Interior heat syndromes: flushed face, fever or feverishness, thirst, restlessness, constipation, deep color scanting urine, reddened tongue with a yellow coating, and rapid pulse. If there is a pain, it is aggravated by heat and alleviated by cold. If there is expectoration, the sputum is thick, sticky, and yellowish. These criteria help physicians distinguishing between cold and heat syndromes in most cases, but special attention should be paid to the following aspects: transformation of cold into heat, coexistence and interlocking of the cold and heat, as well as pseudo-cold and pseudo-heat. In complex cases of the coexistence and the interlocking of cold and heat syndromes coexist. They have 4 main patterns: cold in the exterior and heat in the interior, heat in the exterior and cold in the interior, cold in the upper and heat in the lower, heat in the upper and cold in the lower. Deficiency versus excess. Deficiency and excess define opposing forces, the pathogenic factors which attack the body's anti-pathogenic factors which resist the pathogenic factors. Deficiency refers to a deficiency in the body resistance. Excess refers to an excess of pathogenic factors. When pathogenic factors are lacking or weak and the body resistance adequate or strong one is in a healthy stage or will soon recover from the illness. Deficiency syndromes may be congenital, but in most instances they are acquired from the improper diet, emotional influences, stress, chronic diseases, and wrong treatment. Since the body's anti-pathogenic factors include yin, yang, qi, blood, and sensor fluid, and various functions of internal organs, deficiency syndromes can be classified accordingly: deficiency of yin, deficiency of yang, deficiency of qi, deficiency of blood, and so on. The manifestations of different categories of deficiency syndromes are so diversified that they can't be summarized adequately. The following are the common features of most deficiency syndromes. Excess syndromes. The word excess here is directed at the pathogenic factors. Excess syndromes are syndromes caused by excessive pathogenic factors. pathogenic factors may be exogenous or endogenous. In most cases of simple excessiveness, the pathogenic factors are exogenous. Many endogenous pathogenic factors are the products of dysfunctioning 脏腑 organs, such as retained fluid, phlegm, and dim-stagnant qi and blood. The related internal organs may be in a deficiency state. For example, the insufficiency of the kidneys with retained fluid and diminishes the function of the spleen producing damp or phlegm. Therefore, the syndromes caused by endogenous pathogenic factors may be simply of the exercise type, but may also be the deficiency syndromes complicated by exercise symptoms. The manifestations of exercise syndromes vary greatly in accordance with different pathogenic factors and different portions of the body involved. In most cases, the presence of excessive pathogenic factors is associated with the active response of the body's resistance. Therefore, if there is a fever, it is often high. If there is a pain, it is aggravated by pressure or accompanied by tenderness. If there is coughing, it is harsh. Generally speaking, an exercise syndrome is often seen in an acute disease of short duration, particularly in the patient with a strong constitution. Think coating and phosphopaths are the most prominent features indicating the excessiveness of a syndrome. An exercise syndrome should be further diagnosed in accordance with the category of pathogenic factors and portions of the body, 脏腑 organs involved in the disease, as well as the cold or heat nature of the syndrome. A combination of exterior versus interior, cold versus heat, and deficiency versus excess. Since each of the three pairs of the parameters reflect one individual aspect of a syndrome, they should be used in combination as the guiding principles for diagnosis in traditional Chinese medicine. Therefore, syndromes can be classified into the following patterns if jammed or complicated cases are excluded. Exterior deficiency syndromes further divided into exterior deficiency with exogenous affection and exterior deficiency without exogenous affection. Exterior excess syndromes further divided into exterior cold syndromes and exterior heat syndromes. Interior deficiency syndromes further divided into deficiency cold syndromes and deficiency heat syndromes. Interior excess syndromes further divided into excess cold syndromes and excess heat syndromes. Yin versus Yang. Yin and Yang are two most general parameters of syndrome differentiation, being the key link in the application of eight principal parameters. Yin and Yang are used to summarize the other three pairs of parameters. Differentiation of Yin and Yang syndromes is of primary importance and the canon of medicine stage. One who is good at diagnosing a disease by inspecting the patient's complexion and feeling the pain's pulse first identifies Yin and Yang. Deficiency of Yin. Its clinical manifestations consist of the symptoms due to deficiency of Yin fluid or essence, and those due to relative preponderance of Yang, endogenous heat or fear. Deficiency of Yin. Its clinical manifestations consist of the symptoms due to diminished functional activity and those due to relative preponderance of Yin, endogenous cold, and other pathogenic factors. Thank you.